Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and KUAR-FM 89.
And hello again, everyone, and thanks very much for joining us. COVID-19. The pandemic has killed more than 6,000 Arkansans now, sent 3 times that number to hospitals. And not only is the end not in sight, experts believe the situation will get worse, perhaps much worse, before it gets better. Hospital executives and clinic administrators are warning that the stress level has doctors, nurses, and technicians at the snapping point, and that a shortage of staff is imperiling patient care. Situation seems especially dire in small towns and rural Arkansas, which is the focus of this edition. Joining us, LaShannon Spencer, a specialist in health care delivery, particularly in smaller towns, and Dr. Marcia Byers, Director of Regional Programs for the University of Arkansas for Medical Sciences. Ladies, thank you very much for joining us. Doctor, well, let me begin with you. How dire is the staffing situation right now?
Well, the biggest impact that we're seeing right now is actually related to pipeline and health professions education. The COVID pandemic has interrupted our ability to provide student face-to-face clinical rotations. My role within regional programs is not specific to the clinical care of patients, but more the pipeline and addressing health professions shortage gaps in Arkansas. And it's really had a significant impact on our ability to recruit young people into health professions.
Yeah,
I think what we'll find is a gap coming in the next few years.
Right, the pandemic has just made a bad situation that much worse, or am I misstating the situation?
No, you're absolutely right. We train hundreds of students every year. Regional programs is a collection of 8 sites that are located in rural and distant areas in Arkansas, distant from central Pulaski County. We provide care to over 50,000 patients. We have approximately 200 patient visits. Obviously, when the pandemic hit, we had to train all of our professionals how to provide distant virtual patient care visits. Also, as I mentioned before, it created a situation to where we are unable to adequately train our health profession students, including medical students, pharmacy students, nursing students, and physician assistant students in our actual clinics and give them that patient experience that they need. So I think that we're going to continue to see that impact as we move forward, especially with the variant.
Well, there is some assistance coming in terms of financial assistance. I think Mr. Hutchinson said just a couple of days ago, the governor said a couple of days, there's about $250 million in health money that's made available to Arkansas now. Can that make a difference, or are we just locked into a situation for the balance of this pandemic?
I think that will help. I'm not sure that it will provide assistance for the specific problem of having our students in face-to-face opportunities. However, we have been able to transition many of those activities to virtual experiences where the clinician is in the exam room with the patient. We actually have students that are participating electronically from home within those visits. However, with the upcoming funding, we are working on a couple of grants to specifically address wellness and resiliency in our health professions populations right now and the stress that COVID has placed on all of them.
Yeah, LaShannon Spencer, this is not a surprise to you. This is not news to you.
No, it's not news, and let me just thank Dr. Byers and her team at UAMS and the other 2 medical schools. They've done a very good job of really adapting rather quickly. And when I say adapting rather quickly, to ensure that the medical school students continue to get the education, but just from not a telehealth, but just in that electronic format right now, because they understand the critical need because of the physician shortage that so many of our rural communities actually face pre-pandemic. And so it's just going to continue. And there's a large number of our primary providers that are due to actually retire. So UAMS and the 2 DO schools have done a very good job in trying to make sure that we have a large pool of physicians that could actually go out and practice in rural communities. I think COVID is just that first pandemic, but we need to make sure that we have the necessary infrastructure to help and to be able to assist with future pandemics.
The key word here may be future pandemic, because a lot of the literature that I've read said this won't be the end. When this particular COVID pandemic ends, there will be another.
Absolutely, absolutely. But
no doubt in your mind.
No doubt in my mind, but I think those institutions are looking ahead to the future, but still having to actually look at what's in front of them right now. So I just congratulate them on putting together different strategies in order to really deal with the workforce. And what, Dr. Byers also said, just the whole wellness. We need to ensure that wellness from an employee perspective, clinician, physicians, is actually built into the fabric of the organization. You have so many clinicians, physicians that are just burnt out. They're seeing patients die on a regular basis, and that's actually impacting them mentally. They love nursing, that's why they went into nursing, but we need to make sure that they're actually seeking the necessary care to ensure that they're healthy and whole just as well.
Stay with us. More on this subject coming up. Life in rural Arkansas has its rewards, certainly, but also its risks, and one of them is emergency medical care, and the pandemic has underscored that vulnerability. The time it may take for an emergency medical team to reach an accident victim or a COVID patient and then get them to a hospital, and what to do about that issue. That's the subject of this month's Good Roots. Here's Logan Duvall.
Dispatch 8001, you can show us in Grand Hamilton ×1.
If you live in a rural area and require immediate medical attention, how long will it take for you to receive help? And with the recent strain on hospital space and staff, where will the emergency crews even take you? The answer to those questions and what's being done to help with response times and patient care is this episode of Good Roots. The vast majority of Arkansas can be considered rural, with populations heavily consolidated in only a few areas. For most Arkansans, medical care means travel, and for some, a considerable distance, whether that's for a traumatic event, an earache, or even to get a vaccine.
I'm Robert Thurlby, retired from general internal medicine practice in Russellville and Dover, Arkansas. If someone is moving to a rural area, they need to do research. The ambulance practice, number of specialists, what's available in their town that they're going to be dependent upon, particularly if they've got an ongoing medical problem that requires some sophistication. The ambulance program has improved. They've moved out into some of the boroughs, and they're reaching people earlier. Also, 911 can get you a helicopter in quickly.
In many instances, emergency medicine starts with lights and sirens, ambulances, and fire trucks. For Arkansans living in more rural areas, it can take up to an hour or more for an ambulance to reach the scene. Much of that depends on staffing, locations, access, and equipment. I have first-hand experience in rural EMS, responding to all kinds of emergencies, from traumas and car wrecks, diabetic, cardiac emergencies, after spending 8 years on an ambulance. What is MedTech, and what do y'all do?
MedTech EMS of Conway County. We provide a paramedic level service for all of Conway County. We have 2 primary trucks that are paramedic level trucks that we staff 24/7, 365 days a year.
All the time?
All the time. And then we have a reserve unit that we can staff fairly quickly if needed.
If all of the trucks are out, it does.
And that does happen, yes.
So y'all cover the entire county. So how long would it take to get to the outskirts of the county?
Probably at the max, running code 3, which is lights and sirens, and pending traffic gets out of our way, about 30 minutes.
About 30 minutes, okay, yeah. On the long side. So what has COVID done for EMS?
It's been a big challenge. So with COVID, it's slowed our response on every other call, basically, because when we have a COVID transport, we have guidelines we have to follow, protocols. Once they have transported the patient, they come back, they have to completely decontaminate the unit, and then they have to decontaminate themselves, which means shower, change of uniform, everything. It's been tough. And our guys, it's real, when you think about the long extended transports that they have sometimes with COVID, they're in either an N95 mask or a half-face respirator mask. They have full, gown, suit, Tyvek suit on, so it definitely wears on them. They see the effects of COVID and what it's doing to their patients, and it definitely wears on them.
What biggest challenges have you seen at the hospitals in dealing with?
At the hospitals, it's been wait time. Everybody's doing their best. Let me start with that. Everybody's doing their best. It's just, this is a territory we've never seen before. All of the COVID beds are taken. Just the other day, we made a transport all the way to Mena. That's a 5-hour turnaround time for a transport to Mena. So there's no specialty necessarily that our hospital doesn't have. It's just they have COVID units, a COVID unit. So, and that was the only COVID bed available in the whole state at that time.
EMS typically take patients to the closest emergency department. However, many times in rural areas, they are inadequately equipped and staffed to deal with the most severe cases, and the patient is better suited at a higher level of care. For example, a larger hospital in Little Rock. Pediatric surgeon Dr. Todd Maxson is the chief of the trauma system at Arkansas Children's Hospital, in which he helped to create.
And unfortunately, the beds in our trauma centers are at or near capacity. The impact that I've seen from COVID on the trauma system is pretty significant. I mean, we really have two goals now. We must continue to provide outstanding care, but we've got to protect ourselves, because if we're infected or we spread this, then we just simply don't have the personnel to continue to perform. It's almost a daily analysis of whether we're going to have enough space to continue to do this. So everything we can do in the state to curb the spread of COVID has such important downstream effects for us.
The Arkansas Department of Health, along with several other private healthcare providers, have begun to focus on establishing COVID-19 vaccination clinics in more rural areas across the state in an effort to provide all that would like to receive the vaccine an opportunity. You can find that list on healthy.arkansas.gov.
I feel that rural Arkansans definitely have access to vaccine. And people will call me and ask me, should I take this vaccine? And my answer is yes. Both my lovely wife and I have both had COVID-19, the disease, and we both had dual shots. Our case incidence is going up. We're leading the United States in two areas, both of which are bad. Let's do something about it.
We have so many healthcare workers that have been out from COVID or are continuing to be out from COVID, so we've got to get ahead of this. It is absolutely changing what we do.
Living in rural Arkansas offers many joys, but healthcare is an aspect of life we all must face. For Good Roots, I'm Logan Duval.
Major funding for Good Roots is provided by Arkansas Farm Bureau.
Arkansas Farm Bureau, advocating the interests of Arkansas's largest industry for more than 80 years. Arkansas counts on agriculture. Agriculture counts on Farm Bureau.
And we're back, and I want to go straight to Dr. Byers. Doctor, the Ozark foothills are, that's your native turf, Searcy County, that area up there. What's the situation on the ground? This has a special resonance for you.
Yes, so I do live in a very rural area, and I can absolutely appreciate the challenges and stressors that our healthcare workforce are facing. And I think just with the information that's been shared in this program, you can see the stress of COVID and the impact that it has on our existing healthcare workers in many circumstances, which are already shortages in rural areas of nurses and physicians and pharmacists. So when you add on to that the impact of COVID, whether it's a direct impact with our healthcare professionals being ill or having the burnout and the stress based on all of the traumatic situations that they're seeing, it really is culminating into a significant issue. And I think in addition to that, these are all direct impacts that you're seeing right now. We really have to focus on and think about the long-term impacts on our healthcare workforce. My team is responsible for pipeline programs and introducing students to health professions from as early as middle school, all the way, programs that help these students all the way through the finished product, which in our case is a trained health professional that's placed in a rural area taking care of underserved populations. And so we're transitioning all of our programs to make sure that we can continue our recruitment efforts and continue this obviously very important pipeline and make sure that we don't have additional future strains on our healthcare workforce as a result of COVID.
Well, I was in your neck of the woods just a couple of nights ago, Doctor, at Clinton, and a pharmacist there told me that there has been a real spike in the vaccination rate in Van Buren County and a bit north of there. Are you seeing that in Searcy County as well?
Well, absolutely. I don't have the specific statistics for Searcy County and our vaccination rate, but just from my personal group of friends and family, I do believe that the importance of it is being shared and is obvious and is being understood now more than ever. So I think that trend is probably consistent across the state.
All right. Dr. Byers, thank you. And we'll be right back with more. And we are back. Joining us now, Dr. Dewey McAfee of Unity Health's Medical Center, White County Medical Center at Searcy. Doctor, we thank you very much for coming aboard. Yours is a vibrant and a thriving city, Searcy, but it's not the biggest in Arkansas. Can you give us the situation as you see it on the ground there?
And here at Searcy, that we have actually surpassed the surge about what it was back in the winter of last year when we actually thought the surge was happening, that we are approaching those numbers and exceeding them, and we're making plans that it is going to continue to worsen. We are anticipating up to as much as doubling the number of COVID patients that we will have in our facility within the coming 60 days.
What does that mean, doctor, for the delivery of patient care? What kind of stresses does that put on, A, the staff, and B, the facility itself? What are you having to do or anticipate having to do?
Stress is trying to find enough staff to be able to handle all of that patient load. We're already taxing our nurses up to the maximum ratios that are comfortable for the nurses and safe for the patients. And so we either are going to have to limit the other number of patients that we can admit to the hospital, or we're going to have to find staff that can help take care of the patients. Nursing shortage is one of the biggest things that we have, and having enough nurses to staff the patient load is very, very real. It was real before COVID hit, but COVID has made it even more apparent, and we feel the effects of it much worse. We have empty beds on the floors, but we don't have staff that can cover those beds. So you can't put patients in them if it's not safe for the patient to be there. So we're shuffling where we can and doing what we can to provide the care for those necessary patients.
Correct me if I'm wrong, doctor, but it sounds like the entire hospital there, and I'm White County probably not alone, your facility not alone, but it sounds like the entire facility is now an ER. It's a triage center. Am I correct? Am I overstating it there?
Not too much. Our emergency room is pretty well maxed out. We can't discharge patients fast enough to take care of the patients that need to be admitted. Some of the COVID patients, and because of the nature of the disease, whereas a regular pneumonia, you can figure that they probably are going to be in the hospital. Medicare has it calculated at about 3.5 days is what you're going to be allowed for a regular pneumonia. A COVID patient may be in the hospital anywhere from 2 to 4 weeks in trying to get over the disease well enough to be able to be discharged home. A lot of times these patients have to be transferred to a long-term care facility to continue their care, and so that more acute illnesses can be admitted to the hospital.
LaShannon Spencer again. Let's go to you. Doctor, stand by, please. LaShannon Spencer, this is, again, you're not startled by any. What?
So he's talking about Searcy County. So when you really start looking at the patient,
White County, but Searcy,
Searcy, Arkansas, White County.
Right.
But when you start thinking about the demographics, you have families that actually moved into that because of the great school districts. So prior to now, you saw that age range of 60 and above that's actually occupying a bed. Now you're seeing 40 and under that's now occupying beds. And so you're thinking about that patient population that's actually occupying those beds, but no one's thinking about the financial wealth and the financial strain that it's actually putting on that hospital. So when you're talking about adding additional staff, nursing, that cost, you start adding up some of those patients may be uninsured, the reimbursement rate for Medicare and Medicaid, and so it just really has a domino effect of the overall operations of many of our rural hospitals.
Dr. McAfee, back to you, because my understanding is that one of the effects of this is that when your facility wants to, or one like it, wants to transfer a patient who may require care at a higher level, the hospital to which you would ordinarily transfer that patient can't accept it. Are you seeing that?
Yes, we're seeing that also, and then us having to take care of those things that we are borderline actually capable of taking care of. But when the patient can't go to the higher level, we're having to take care of what we can. And sometimes the patients do have to be transferred further away than what we're used to having to transfer patients.
LaShannon Spencer, back to you.
Yes, sir.
Well, if you want to pick up on that.
He talked about having to transfer.
Right.
Think about that cost of having to transfer. We're only thinking about nurses right now, but he's having to make sure that there's a case manager, and that case manager is dealing actually with that particular patient's family, but also having to have that constant communication with that potential receiving hospital that's actually going to receive that patient. But also there's so many other factors that's actually impacting the operations and actually taking time away from patient care when you have to deal with situations like this.
Or to both of you, we have school starting in just a short number of days now. Do you want those kids masked?
I do. I want kids masked. I want teachers masked. I want people to really understand the importance of wearing a mask. Steve, I think about grandparents that are having to take care of their grandchildren that's under the age of 12. We need to make sure that as soon as that vaccine becomes available, those children can actually be vaccinated. It is the responsibility, in my opinion, of a parent to ensure that their children is vaccinated. It's not just about that child or the parents that are actually living in that home, but it's about that teacher. It's about other individuals and members of communities as well.
Dr. McAfee, back to you. Given your druthers, do you want to see those youngsters masked?
Yes, I do. It doesn't take much to look at when the masks were mandatory. We had a certain level of infection. Once the masks were removed and the necessity to wear them all the time, the number of cases has exponentially grown, and it's putting us into the point to where we are now. Between Arkansas's reluctance to get vaccinated and their animosity to wearing masks has caused part of the problem of why we have such a high rate of infection in our state. The number of people being vaccinated is increasing. They're finally getting the message that the vaccination can help them. At least if you're vaccinated and you get the disease, you're not going to die. You may get sick a little bit, but you're not going to die.
As a physician, Dr. McAfee, how do you think how has the political class in Arkansas responded to this pandemic?
It's evident that the legislature did not allow the governor to mandate wearing masks again, so that pretty much sums up their attitude.
I ditto. I think about over in Marion when school opened and kids were actually unmasked, the number of students that actually tested positive, the impact that it had on those children. Just over the last 18 months, our kids have been, a lot of kids, virtual. Virtual learning has really had such an impact on our children's mental health and their wellness, and also the increase in suicide rate among the young people that's actually going to school online. It's increased.
Academic achievement's down too.
Academic achievement is down, but I would like to say kudos to the Little Rock School District and School District in Fayetteville. They understand, and so they are making that conscious effort and making sure that masks are required within their schools.
Got to end it there because we're simply out of time. With Shannon Spencer, Dr. McAfee, thank you for your time very much, both of you.
Thank you.
Thank you.
And come back soon, both of you. And you too. We'll see you next week. Thank you as always for watching.
Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and KUAR-FM 89.